Hello, my name is Jan Spivey. Welcome to the Global Game of Implants. It's a new series of podcasts in search of the truth about breast implant safety. I was diagnosed with multifocal breast cancer in 2002 when I was 39 years old. I underwent reconstructive surgery using the latissimus dorsi muscle from my back, but that wasn't the only surgery I underwent during the reconstruction. I had the lymph nodes removed from underneath my left arm, as well as the insertion of a tissue-expanding device with a valve, making it possible to add saline to it in preparation for an implant in a later surgery. I also had titanium metal staples to direct chemotherapy. When I woke up after several hours of surgery, the tissue expander was in my breast, a valve was exiting from underneath my left arm, and I had severe pain in my chest and my back, where the latissimus dorsi muscle had been repurposed on my chest to keep the new implant in place. My breathing was different. I felt as if I had a 10-year-old child sitting on my chest. I had a severe local reaction. My chest was hot and red and tightly bound with adhesive dressing. I had a massive seroma on my back, and my arm was still held in a stress-like position away from my body. I was unable to put my arm down and unable to sleep. Still, I was alive and I was grateful. But I asked myself again and again, what led me to this extensive surgery? Was it really necessary? Did I really need to go through all of this so I could feel like a woman? Which is what I've been told by health professionals was the key to my full psychological recovery after breast cancer. I'd been under general anaesthetic for a prolonged period. The massive collection of fluid building up in my back needed frequent aspiration. I was having a severe allergic reaction to the adhesive in the dressings, or so I thought. I was in pain, shock, and deeply distressed. That day marked the beginning of the most painful and distressing chapters of my entire life. I went on to develop systemic illness, autoimmune disease, and a new immunological precancer. It transpires these new symptoms were consistent with what I now know to be breast implant illness. In this episode of the Global Game of Implants, I'd like to introduce Professor Jan Willem Cohen Tervaert, leading expert in BII. Here, in May 2023, giving testimony at the Canadian Parliamentary Committee meeting, talking about the range of illnesses and cancers linked to silicone breast implants and the urgent need for a breast implant register to monitor their safety. Let's join Professor Cohen Tervaert to learn more about breast implant illness and the global game of implants.
I'm going to start with Dr. Cohen Tervaert. You have 5 minutes for an opening statement. Welcome to the committee. The floor is yours.
Okay, thank you, Mr. Chairman. So my name is Jan Willem Cohen Tervaert. I'm a professor of medicine at the University of Alberta, but also emeritus professor in medicine and immunology of Maastricht University in the Netherlands. And currently I'm also a member of the expert panel of medical devices of the European Community. So I did my training and education in the Netherlands, but after finishing my MD and PhD, I was invited to work at Harvard University in Boston in the United States. And in 1993, I returned to the Netherlands with a fellowship of the Netherlands Academy of Science. And at that time, I started my clinics for patients with autoimmune complaints associated with breast implants. And based on this experience, I'm pleased to share with members of the Standing Committee on Health some background information on the safety or unsafety of breast implants. First of all, there have been several scandals with breast implants. Breast implant products are not always in compliance with international norms and standards. And as an example, there were 3 scandals. One in 2010 with the Poly-Implant Prosthèse, PIP from France, and in 2015 with Silimelt, a company from Brazil, and in 2021 Belagel from Korea. Furthermore, the Dutch National Institute for Public Health and Environment published in 2015 a market surveillance study that demonstrated that the technical findings of all 10 manufacturers that are having a market in the Netherlands with breast implants were not in order. And in one case, there was even a very high level of contaminants in the breast implant. Finally, in 2018, as well known, the International Consortium of Investigative Journalists released the implant files demonstrating many shortcomings in breast implant clinical trials. So what are current diseases that are associated with breast implants? There are 3 different types. Firstly, a malignant disease. In 1997, a specific implant-associated malignant disease was firstly reported, so-called anaplastic large cell lymphoma, BIA-ALCL. Based on the Dutch mandatory registry for pathology specimens, Daphne de Jong et al. Demonstrated in 2008 already clearly that BIA-ALCL in the Netherlands was caused by the breast implants. In 2011, the FDA issued a warning, but stated that they were not possible to identify a possible association between breast implants and BIA-ALCL. But since most patients with ALCL had textured implants, the FDA and Health Canada requested Allergan in 2019 to recall its textured implants. More recently, in 2023, the FDA and Health Canada issued a safety communication that also other lymphomas and breast implant-associated squamous cell carcinoma may occur in patients with breast implants. Although an accurate estimation how often these malignant tumors occur in patients with SBI do not exist, ALCL researchers calculate the risk to be 1 in 2,832 women. Apart from malignancies, there's also various autoimmune diseases that are reported to occur more frequently in patients with breast implants. Also here, the estimated risk is very difficult to quantify, and it was for a long time debated even if breast implants really were a risk factor for the development of these autoimmune diseases. In 2018, however, a very large study from Israel convincingly demonstrated that autoimmune disease occur more often in patients with breast implants than in women without these implants. Patients with breast implants appear to have a 45% higher risk to develop autoimmune diseases such as sarcoid, systemic sclerosis, multiple sclerosis, rheumatoid arthritis, and other autoimmune diseases. Just as found for malignancies, most diseases occur only after 10 years after the implantation. And finally, there's a third group of diseases. Patients with breast implants often have symptoms suggestive of an abnormal functioning autonomous nervous system. Symptoms that these women have include severe fatigue, widespread pain in muscles and joints, severe dry eyes, severe dry mouth, feverish feelings, and cognitive impairment. Nowadays, this disease is called breast implant illness or autoinflammatory immune syndrome induced by adjuvants due to silicone incompatibility. The symptoms also here occur generally after 7 to 10 years after the breast placements. And explantation causes in about 80% an amelioration or disappearance of the symptoms. Although here also an accurate estimation how often this occurs does not exist, our studies suggest that 1 in 4 women, so 25%, may develop at least 3 symptoms suggestive of this disease 10 years after breast implant. So why do we need a national breast implant registry? It is estimated that about 3 to 4% of women in Western countries have breast implants. 70% are placed because of cosmetic reasons, whereas 30% are placed because of a reconstruction after mastectomy. When the PIP implants were recalled in the Netherlands, there was only a voluntary registration, a so-called opt-in registration. And this meant that only 10 to 20% of the women with PIP implants could be traced. So furthermore, with a registry, there is a possibility to calculate how often local and systemic complications really occur after breast implant placement. Since there were never randomized controlled clinical trials performed to demonstrate the possible safety or unsafety of breast implants before it was registered, we currently only have post-marketing surveillance to monitor its safety. Manufacturers need to conduct these studies, and plastic surgeons need to report events to the manufacturers. Unfortunately, there are no criteria for these reports. Reports are only infrequently made by surgeons, and reports are not peer-reviewed, and these reports are not open to the public. Because there are several signals that breast implants may not always be safe, it is prudent to start with a registry as soon as possible. And as discussed, this should not be a voluntary opt-in registry, but a mandatory opt-out registry, where only the patient and not the surgeon has the choice to participate or not. What are the requirements for a registry? There's a few things: an opt-out system. The data set that can be used could be the same as in Australia and the Netherlands, but there should also be a PROMS data set, so patient-reported outcome measurements. Compliance with the mandatory registry could be an issue. In the Netherlands, it's arranged that all hospitals and all private clinics have legal responsibility for the registration. And in addition, compliance to the registry is a requirement for renewing licenses of plastic surgeons. To facilitate the registry, manufacturers should be asked to develop barcodes on the implant so that with barcode scanning module, the registry can be done without mistakes. And the funding of a registry might be an issue. In the Netherlands, it's established that patients pay $40 Canadian extra for their surgery. Patients with breast reconstruction do get this reimbursed by their health insurance. So in conclusion, breast implants are high-risk medical devices. Long-term sound epidemiological data are, despite the fact that these breast implants are now more than 60 years on the market, not available. Recalls have been made in the past and are probably needed in the future. Recalls are not successful if there is no good registry. And it is my opinion that there's an urgent need to start a national breast registry. The registry should be used by all surgeons that place implants, and the registry will provide us with better information about the diseases that are associated and or caused by these breast implants. Thank you very much, Mr. Chairman.
Thank you, Doctor. 6 minutes, please.
Thank you, Mr. Chair, and thank you to all the witnesses for being here. Can any of you give me or our committee a general idea how many Canadian women have been injured by breast implants?
Well, I tried to calculate that. So we could say that from the other experiments in other countries, it's calculated that about 25% of the patients with breast implants have issues that might be due to the breast implants.
Okay. Now, for those of us that aren't used to medical epidemiology and risk factors, is that considered a high risk for what can sometimes be an elective surgery?
It's an extremely high risk.
Thank you. Dr. Cohen, Tervaert, staying with you, if I had your words correct, you said there were some issues with implant trials. I imagine this was the clinical trials that were probably done by the manufacturers. Can you expand a little bit on that? What were the issues with the implant trials?
So the FDA recommended trials when the ban was lifted. However, these trials were not done and were not done properly. So we had a FDA meeting, I think 3 or 4 years ago, where I was also a witness. And there many patients actually came forward and said, well, I participated in these trials, but as soon as I developed complications, I was sent out of the trial because I had complications. So those are not proper trials.
Who was conducting those trials?
Mentor and Allergen.
Now, you've identified 3 major potential negative problems from breast implants: malignant disease, breast implant, ALCL. Number 2, autoimmune disorders. And number 3, so-called breast implant illness. Is there an implant on the market today that significantly avoids these 3 risks?
No, we did do a comparative study where we compared the modern implants with the implants that were placed 20 years ago, and we saw the same symptoms occurring in the patient. So there was no difference in implant quality. So although the manufacturers always state that their implants are better and better and better, right, we don't see that from a rheumatological or autoimmune field.
Okay, I'm going to ask an obvious question to a layperson. We have a device that causes an extremely high rate of serious problems, and I would take you to agree with me that malignant, the cancer, the autoimmune disorders, and the autoimmune nervous disorders are fairly serious, are they not? Conditions?
Well, causality is an issue here always. The malignant disease is clearly caused by, there is a specific mutation that occurs that is not seen in other forms of ALCL. The causality of breast implant illness and the breast implants is still debated. I recently put up research where we showed with the current Bradford-Hill criteria, which is the criterion that we use to support causality, that breast implant illness is indeed caused by the breast implants. Bradford-Hill, go back to the discussion with smoking. In the late 19th century, it was already clear that some patients who smoked did get lung cancer. However, it lasted until 1960, until it was proven, causality was proven that it was, and that was Dr. Bradford-Hill who did that. So it is very difficult to fight against the manufacturers.
Sure. So if I understand you correctly, the BIALCL, at least one version, there is a causative aspect established. The Israeli study said there's that, a large-scale study said that there's a 45% higher risk in women with breast implants to get an AI disorder over those that don't.
Yes.
And 25% of women would have 3 symptoms or more after 10 years after breast implants in terms of the autoimmune nerves. The question I would ask is, should we be allowing these to be implanted at all, given those health impacts, at least for people who don't have a medical, say, indication for one?
Yeah, so I'm not the one who decides that. Yeah. But clearly, my statement is always, if we are continuing to give breast implants to healthy people, they should be well informed, and preferably, I would say, you are a guinea pig, and if you want to participate in this study, yes, you're allowed.
Awkward question, doctor. Do you have a daughter?
Yes.
Would you recommend that she get breast implants?
Never.
Dr. Morris,